Hello colleagues, my name is Karamo B. Toure, a second-year student in physiotherapy. This video is on serratus anterior muscles and winging of scapula. The objectives of this video is to help students and prepare them practically on winging of scapula. Winging of scapula occurred because of the paralysis of serratus anterior muscles. Serratus anterior muscle is originated by the 8 digitation from the outer surface of the upper 8 ribs and the fascia covering the intervening intercostal muscles. Insertion. It is inserted at the costal surface of the medial border of the scapula. A. First digitation is from the superior angle of the spine till the inferior angle. 2. Neck 2 digitation from the roots of the spine till the inferior angle. C. Lower 5 digitation on the triangular area over the inferior angle. Now we are coming to the actions of the serratus anterior muscles. It keeps the medial border of the scapula in contact with the chest wall. Number 2, it involved in the protractions of the scapula that is pulling the scapula forwards around the chest wall, and this happens when a person pushing or punching actions. This is why it is called a boxer's muscle. As we can see, a person pushing the wall and the second one is punching the wall. Here, the scapula moving forward along with the chest wall. So, because of this action, the muscle is known as boxer's muscle. The third action is, it rotates the scapula laterally and upward, that is along with the trapezius, so that the glenoid cavity faces upwards and thereby help in overhead abductions. Here we can see the glenoid cavity faces upward, thereby it helps the overhead abductions. When do we need these actions? It is when we did abductions over the head. That is one of the purposes why this muscle is needed. Let us now look at the nerve supply of serratus anterior. Serratus anterior muscle is supplied by the long thoracic nerve with its root value of C5, C6 and C7. It picks its origin from the roots of the brachial plexus directly. It is also known as the nerves of Bell. Now we are going to look at the cause of these nerves. It arises from the neck, from the ventral rami of C5, C6 and C7 spinal nerves. It passes behind the brachial plexus in the posterior triangle of the neck and enters in the axilla by passing through cervico-axillary canal. The canal is between the cervical region, that is the neck, and cervico-axillary canal is bounded anteriorly by clavicle, medially by the forceps, and posteriorly by upper border of scapula. Then it leaves the axilla and runs on the outer surface of the serratus anterior muscles and supply its digitations. Now this becomes rare occurrence because most of the muscles supply the deeper surface of the nerve. In this case, the nerve is supplied by the superficial muscle, that is why it is liable to get injured. Now winging of scapula. It is known as winging of scapula, boxer's palsy, swimmer's palsy. Now what will be the effects of the injury to the long thoracic nerve? First, the condition is known as winging of scapula. It is also known as boxer's palsy. It is also known as swimmer's palsy Let us see why these names are given. The effects would be the medial border and the inferior angle of the scapula. They will become unduly prominent. They will project backward and medially, especially when a person is called to push against the wall in front of him or her. In this point, the medial border and the inferior angle always become unduly prominent, and it appears as the person got wing attached on the back. That is why it is called winging of the scapula. Now we will see the winging of scapula. It is caused by an injury to the long thoracic nerve, and which results in paralysis of serratus anterior. How and when does it occur? It may occur in mastectomy with axillary node dissection.